It's really hard to be away from home, and having a home-like atmosphere means everything.
I think your breathing just changes. I think there's a sense of peace.
It's relaxed, it's fresh air, it's beautiful, it's got everything.
I don't believe he would have been where he is today without Crotched Mountain.
In September, Courtney suffered a cardiac arrest suddenly with no previous symptoms. She's always been athletic and healthy and conscious of what she eats, and she had a cardiac arrest and suffered an anoxic brain injury as a result of being unconscious for over 30 minutes. They didn't give her a good prognosis. They didn't think that she would ever walk again or talk again, that she would be totally on life support, and didn't give us much hope because of the amount of brain damage that she sustained.
About face. How about if we do some side stepping, okay? We're going to step to your left. You ready? Big step left. And together. Beautiful. Beautiful. Chest up. Good. Oh, your posture's perfect.
The therapists here are very caring, very personable. They get to know who the client is, in my case, who Courtney is, and I think it makes Courtney warm up much easier, where she feels like it's not drudgery to go to therapies. You actually can look forward to going to therapies. The therapy pool here, which is one of maybe a handful in the whole country, is phenomenal. My daughter absolutely loves the therapy pool. It offers safety, resistance, and fun all at the same time. And she feels, I think, more secure. The water helps support her, and Judy, her therapist, has been incredible with her. They get along great, and she really likes that.
I don't think you saw the pictures from the hockey game that we went to.
She's exceeded everyone's expectations. She's walking, she's talking, feeding herself, swimming, snowboarding with help of adaptive equipment and therapies, and it's going to be a long road, but she's doing much better than anybody thought she would be doing at this point.
Crotched Mountain gets phenomenal results. Nearly all of our patients are discharged back to their home setting rather than to other institutional settings. We measure ourselves against comparable institutions elsewhere, and in every respect our outcomes are better than they are elsewhere. And that's simply a standard that we feel we need to adhere to.
Crotched Mountain is a very special place because we try to address the needs of the whole patient. We are addressing their medical needs, their social needs, the needs of their family, looking deep into their past life and their life after they leave us as to how we can get them into the community, living a very full and productive life.
Are there any other reports?
We have a real high level of expertise as clinicians. I think we really strive for excellence. We have a lot of things that support that, such as a grand rounds where we're constantly getting updated on latest information. We have a good support system for sending therapists to continuing ed courses. So we're really looking to keep our therapists up to date in every area. So I think they'll find a level of expertise, and I think they'll find a level of caring that's hard to find in other places. And that combination, I think, is what sets us apart.
Do you know who my speech therapist will be?
Right, good question. Right, so we want to ask that question so you can kind of plan ahead.
After a brain injury or other illness, technology can provide a means to try it a different way. If traditional mobility like walking doesn't work for you, technology can provide an alternative. If speaking is difficult after an injury, then technology can offer the ability to speak via a communication device, an augmentative communication device. Everybody is very, very unique and different that we serve here. And so a one-size-fits-all solution is just not appropriate.
You think you can do 20 more punches? Keep yourself up.
Wind that arm back.
1, 2, 3, 4.
Our staff ratio is it's phenomenal. It's the best I've ever seen anywhere. And so they have a significant amount of time to work on ADLs, on the activities of daily living, on carryover of all the programs, of carryover feeding programs, of standing programs, of walking programs. They have the time to be able to do that.
Now, what about this goal? You see that? Losing weight?
Yeah.
You're doing good on that, aren't you?
Yep.
Yeah, you're doing great on that one, I thought.
We
feel like you're
get
doing
so involved in people's lives, and it's a privilege and it's an honor, and those are kind of trite sayings, but to be able to work with our clients on their journey to recovery, you can't help it. You know, it's a people business, so we connect, and that's probably, I think that's what we do the best.
It was July 2nd, around 10 p.m. at night. We received a phone call that Matt was in a horrible car accident with one of his good friends that was driving. The hospital was like, you know, come in, you know, tell him you love him and pray. And he had about 8 hours of surgery. He had a severe traumatic brain injury. And that was the worst injury, was the brain injury. So he came here still in a coma, needing full care. 22 days after his accident, he was still in a coma. The therapists were wonderful. They just treated him like he was awake. They would get him up in a wheelchair. They would start moving him, bringing him outside. 5 hours of therapy a day. And he started to react within a week that we were here.
Let's see the stand up.
Look at you. Oh,
nice. Good job. Good job. How you doing?
Good.
They really treat you like family. I never looked at it as a hospital. I always felt like, because we were all here for the same reasons, even the other families and parents, you become very close, you have a bond. Right from the start, they insist that the family come in and watch, and any questions, concerns, anything. They were just wonderful. And their goal from the beginning, even when he was in a coma, was he's going home. You know, that was their number one goal. So when we did bring him home, the transition was wonderful. Whatever he needed for home, we had it established before we left. Like, they set up a home tutorer for schooling. We had PT and OT, outpatient therapy taken care of before we left. I mean, I bet he was on 20 different medications. And I'm not a nurse, so they were wonderful about dosages, and they had charts to make sure that, you know, everything was done by the book. So the transition was pretty easy.
And this is a perfect place to go to, because they work you hard after that, and the main focus is like having you getting better.
The transformation of someone from an unconscious critical state to someone who's making progress walking and making progress with voice and language is really watching them return to life.
I do have a child with disabilities, and she does live here at Crotched Mountain on the mountain, and this is a place that I trust. This is a place where I can walk away and know that she's getting the best care, and I don't have to worry about what's happening when I'm not there.
She has exceeded where we thought she would be at this point by months. Months. I mean, I'm amazed that she's walking as well as she is, and talking as well as she is, and feeding herself, and doing things that we didn't think would happen for half a year or more. So I would have no problem recommending this place to people whose loved ones need this stage of therapy. This is, to me, this is the place.
I would never want to go through it again, but if I had to, I wouldn't go anywhere else.